You are watching the DocTalk show.
Okay. So, other than bleeding or infection, Dr. Anderson, could there be other problems?
Yes, trauma to the reproductive organs. Remember, these people have no skill, so they just get whatever they can use to, perforate. So we can end up with a perforated uterus, or there are many blood vessels that supply the uterus. So if you perforate the uterus, you might end up even perforating some of those blood vessels. And they are huge vessels, so if you bleed, you're more likely to exsanguinate very, very fast. Yes, so we have seen people who have perforated the uterus, perforated the gut, the intestines, and it's a whole lot. And this becomes very expensive in the long run because you're going to come to the hospital, you're going to have an extensive surgery, you stay in the hospital for 2 weeks, you're having antibiotics. So it becomes very expensive for the government as well.
And in some cases, even the perforations can be very severe, and the doctor is forced to perform a procedure to completely remove the entire uterus.
You lose the uterus, and most of these are young girls. You don't have any child. This was your first time to get pregnant, and then you lose the uterus, which means you have no chance of ever conceiving again. You see?
So abortions can cause infertility from problems arising due to perforation and injuries to the organs. So we've looked at bleeding, infections, and injuries. Could there be any other?
Death.
Death as the final.
As a final one, you are more likely to die if you have a very bad infection that can't be treated with available antibiotics, or if you bleed out, you can die. Your heart will stop and then you'll die. And some people, especially in the villages, will use herbs. Some of these herbs, we don't know their effects on the liver, on the kidneys, and see, you might end up with kidney failure, liver failure, and all these things will, cause lots of issues.
So the bottom line is, unsafe abortions are very dangerous. They come with so many problems. If it is done in an environment which is unclean and unhygienic, it is carried out by people who are not qualified to do these procedures, and the techniques employed are severely wanting. That's what makes it unsafe. And we have listened to all the complications. What can arise? The mother may end up bleeding out, excessive bleeding, either they have injured the blood vessels or something. The mother might end up losing the uterus, the womb, because of the injuries. If it's done in very poorly, you get infections and all the other problems that come with it. So, in a nutshell, unsafe abortions are very dangerous. So, I think we must sensitize the community to avoid having unsafe abortions. Okay. But in a country where the laws are restrictive of abortion, it also puts you in a tight situation. If you're telling people do not have unsafe abortions, what do they do? Yes. But that's for another topic to debate about. So, abortions, whether intended or unintended, can always be prevented in the first place. We all know the dangers of abortions. Can result in loss of the mother's life, can result in infertility, excessive bleeding, or infections. And these are big killers in young mothers. We learned that majority of the abortions tend to occur in teenage pregnancies. These are adolescent girls who have their first pregnancies, often early in their lives, somewhere between 15 to 19 years. So how can we prevent these abortions from occurring in the first place? Dr. Mugisha, prevention is always better than cure. In almost every field of, whether it's disease, communicable, non-communicable, prevention is always sung. It's a song of the day. Prevention better than cure. How can we prevent these abortions from happening in the first place?
So,
for
thank you.
whichever reason, regardless of the cause.
The most effective way would be to prevent unintended pregnancies. Because once you get a pregnancy that is unintended, you're going to try and seek all possible ways to revert your life back at all costs. and within a restrictive country, you know, we can't be sure whatever you choose will be safe. So how do we prevent that unintended pregnancy? And of course, our women and girls try to shy away from these very specific interventions we try and give them. Say, for example, trying to offer them a contraceptive, a very effective contraceptive option. You know, I have friends and many other clients I really interact with, they will be reluctant to take up some of these contraceptive methods.
Like the family planning methods?
Especially family planning methods, yes.
Which methods are available to young girls?
There's a very wide variety in our current setting of contraceptives we can give. So whether intrauterine devices, what we call the coil, hormonal methods, whether pills or barrier methods like condoms, implants, many other injections. Some injections we can give either monthly or twice a month, or you know, every other 3 months. Many injections we can try and give to try and help you prevent these unwanted pregnancies. But you see, in our traditional settings, many people hold back because of many beliefs and myths. We request you please visit any medical qualified, and they try and demystify some of these concerns that you have.
So you're saying family planning can be available to teenage girls,
yes,
to adolescent girls. What is the earliest age a girl can access the family planning?
Well, because now girls are sexually active as soon as 12 years, you know, 12, 13. You will see a very young girl pregnant at 13 asking you, how do I get rid of this? And also, you know, sexual activity in our modern life really starts as early, I think, as 10, 12. But if you walked into my clinic at 12 years, I think I can offer you family planning.
Family planning should not be restricted regardless of age. Even a girl as young as long as they're sexually active, if they are within the age of sexual activity, and it starts around the time of puberty, that's maybe 12, 13 onwards, they should be able to access family planning. Yeah, and there, like you learned, there are very many methods which are available, whether it's condoms, the injections, or the pills. All these are effective in preventing the unwanted pregnancies in the first place. So in the case you are avoiding the abortions and all the problems that come out, by having some form of contraception to use, okay? But I wonder, why are people shy about giving contraception to teenage girls? Dr. Andeze, what do you think about
I think it's may not be something to do with being shy. It's what our culture is. We do not expect these young girls to be having sex at this time.
But the reality is...
But that is just ideal. You see, even the most Christian people, we think, you know, at this age they should not be having sex, but they are having the sex. And that's the fact. So how do we prevent these people from not having the complications that come with unintended pregnancies? You know? Don't shy away. If you can abstain from sex, very good. If you cannot abstain, get a contraceptive method, you know, so that you can prevent the long-term complications which can get infertility and all those things. So it's our culture which is still, you know, people shouldn't see me going to the clinic. People even fear to go to a shop to buy a condom, you know, and that is killing us.
Okay.
You know? Yeah.
Yet these are the life-saving interventions which are available.
Exactly.
And some are even free of charge at the hospitals.
Yes, there are many hospitals, they are free condoms, they are free contraceptive methods, injectables, IUDs, implants that Dr. Mugisha was talking about. They are free in every hospital you go to.
So we shouldn't, girls shouldn't feel shy in accessing these services, or even teenage boys, or whoever is sexually active. Just walk to the hospital and ask for a family planning method, and it will be given to them. Okay? Even as health workers, they shouldn't be the hindrance, be the barrier. If you see an adolescent has come for the service, give it to them. You don't refuse.
You are watching the DocTalk Show.